Back in 2016, I was contacted by some universities in the UK who were applying for a health technology assessment grant. And the purpose of a health technology assessment grant is to look at technologies which are on the brink of becoming a standard of care, but just need that extra bit of evidence to push them over the line. And in this case, what they wanted to look at was the use of bracing for knee osteoarthritis. They conducted what to date can be considered the largest and most rigorous study ever performed in knee osteoarthritis bracing. These patients were randomly allocated to one of two groups. One which received what's considered best practice. They got advice, information and exercise, and these protocols were based on previous research from the same group. The other patients were allocated to the same advice, information and exercise plus a brace. Now it should be noted that for medial and lateral compartment patients, they did have the option, for whatever reason, they didn't like the unloader, or if the practitioner, the physiotherapist, felt that another brace was warranted, they did have an option to receive the DonJoy Nano. But not a single patient ended up choosing that. They all went for the Unloader 1. The primary outcome measure for this study was the KOOS-5 at 6 months. And the KOOS-5 is an aggregate of 5 separate subscales. You're looking at pain, activities of daily living, symptoms, sports and recreation, and quality of life. And to cut to the chase, yes, they found a significant difference in this at 6 months. The brace group was doing better than the group without the brace. Why is any of this important? Why is this study meaningful? Well, there's lots of reasons. And perhaps we can go back to the participants they selected. The fact that they took these patients from across the northeast of England, from the community, from primary care, means that the external validity of this study is very high. Typically for these type of studies, they recruit from the office of an orthopedic surgeon. And those patients are further along the line. They've maybe tried all sorts of other treatments already by this point. Furthermore, the enrolled patients had both stable and unstable knees. Now, there's been this idea that OA knee bracing only works for patients with unstable knees. But what they found in their study was there's no difference between the stable or unstable knees, and both had similar outcomes. Another point that makes this such a strong study was that for the large part, almost all these secondary outcomes agreed with the primary outcome. In particular, pain and activities of daily living showed significant differences at 3, 6, and 12 months. One of the complaints we often hear about knee braces is that people stop wearing the brace. And there are plenty of reasons why this might happen. Often people won't wear it because it doesn't fit under their clothes, or maybe it irritates the skin. But interestingly, we found at 12 months the single most cited reason for not wearing a brace was that they felt better. So this one-of-a-kind study provides really good evidence for what we here at Össur have known for a long time, that knee osteoarthritis bracing, the Unloader 1, can make a difference in our patients' lives.